Good morning, everybody, and welcome to this Committee on Budget and Fiscal Reviews hearing looking at California's child care and development system. Also, we'll be delving into some of the facts of California's sky-high poverty rate. Over 8 million Californians living below the federal poverty line, which does not even include a line item for the cost of child care in determining what the federal poverty line is. So it's actually even a higher amount as opposed to the $24,500 for a family of 4 in California. It also doesn't account for the 30% higher cost of living that we have here in California. Specifically, how that impacts California's children, where over 26% of California's children are living below the federal poverty line, and for African American children and Latino children, more than a third, which is really an astounding fact. And that has great ramifications throughout our entire state. Of course, studies have been done, and we'll be hearing about them today. Children who are raised in poverty are more likely to drop out of school. A child without a high school diploma has a 7 times greater likelihood of finding his or her way into our criminal justice system. So poverty impacts crime rates, which is a definition of the safety that we have in our neighborhoods and our communities. We also know that children suffer mentally as well as physically, higher rates of disease and illness in poor communities, and making it harder for people to get and keep jobs. So there's a lot to look at, and we'll be looking at some best practices in other states and seeing what we can do. Add to all this, of course, that we've cut $1 billion from services that provide child care for low-income working families in California. And of course, without child care, quality, accessible, affordable child care, people can't get to work. So with that, we're going to start our first panel on child poverty, and we ask that Dr. Ross Thompson join us, Distinguished Professor, University of California, Davis. We also have Michelle Stilwell-Parvensky, who's the Senior Policy and Communications Associate at the Children's Defense Fund. And then the third panelist will be Kim Kruckel, is the Executive Director of the Child Care Law Center. Welcome, everybody. We're pleased that you've given us your day. Doctor, we're happy to start with you. And before you do, why don't we call the roll, and maybe that will encourage other members who are in the building to join us.
Senators Leno?
Here.
Nielsen?
Here.
Allen?
Here.
Anderson? Bell? Block? Hancock? Mitchell?
Here.
Monning?
Here.
Morrell? Wynn? Han? Tabley? Roth? Stone? Wolk?
Thank you very much. And it should be noted that there is another hearing scheduled in this room at 1:30. So I'm going to be moving things along to make sure that we get through all of our panels, that everyone here who's waiting to speak for public comment will have your opportunity as well, and that we be respectful of the next folks who are going to be using the room. Dr. Thompson, welcome.
Thank you. Chairman Leno, Senators, I'm Ross Thompson, Distinguished Professor of Psychology at the University of California, Davis. I'm also a member of the Executive Committee of the Center on Poverty Research at our university. I study social and emotional development in young children and the applications of our knowledge of children's development to issues such as school readiness, family relationships, early childhood mental health, and the effects of poverty on children. So I very much appreciate the opportunity to speak to you about poverty and its effects on young children. Before I do so, however, I want to alert committee members to the release next month of a Blue Ribbon Committee's report from the National Academy of Sciences. The report focuses on the science of learning from birth to age 8, with a particular focus on the implications of the science for workforce development. As one of the members of the committee, I'm fairly sure that you're going to find information in that report that is relevant to our thinking about what kinds of things do we need to do to provide both the services that children need from in that crucial developmental period up to 3rd grade, and particularly what do we need to do in preparing the workforce to provide those services. So I hope your staff will make sure that you get a copy of that report when it's released next month. It is common for people to talk about making investments in children's development, and although I think it can be misleading to think of children's development as we would the development of a business or a bank account, it can be helpful in this respect. The investments we make in strengthening the foundations of lifelong development in the early years really do yield long-term benefits, both for children and for society, in their improved education, health, and earnings. These investments can be costly, as we all know, but the failure to make these investments does not mean that we save money. Rather, it costs us in two ways. First, for the children, there are behavioral and biological problems associated with aversive early experiences, including poverty, that significantly increase the chance that they'll fall behind educationally, become dependent on public assistance as adults, experience enduring health-related problems, and fail to acquire the skills necessary for success in this information-driven technological age. But secondly, for the state, there are costs in paying for remedial education, public assistance, and healthcare, and also the cost to economic productivity of having a workforce that is falling behind those of our trading partners and competitors, especially in Asia, that are currently making significant investments in the quality of early care and education. So in short, we either pay now by improving young children's quality of life, or we pay later in the cost of remedial services and lower economic productivity. These conclusions are not just my own. They're based on extensive research on the immediate and long-term effects of poverty on children's development. And in California, we should be especially concerned about this research because of some of the information that you were describing, Chairman Lino. Because more than 1 in 4 children in California live in families below the poverty line. And when you add to that more than 2 in 4 children living in low-income families, we find that nearly half the population of children under age 6 are living in circumstances that virtually anybody would consider to be economically disadvantaged. For children who are Latino or Black, the proportion in low-income families is above 60%. Now, I suspect that you are familiar with some of the things I'm going to highlight about the effects of poverty on children's development, but I also expect that I can tell you some new things that you did not already know. First, growing up in poverty has a powerful effect in undermining children's cognitive growth and their school achievement. Children in poverty do show lower gains on standardized measures of intellectual growth, poorer classroom performance, they complete fewer years of education, and they're less likely to complete their education compared to children growing up in families at higher income. The longer that children are in poverty, the worse are these outcomes. We're also beginning to understand how early these problems begin. Research by Hart and Risley has shown, for example, that by the age of 3, children from the lowest income families have vocabularies that are less than half the size of children living in the most economically advantaged families. And other research by Anne Fernald has shown that this is true in California as well. Research is also showing why this is so. Single parents who are under economic stress have less time and energy to read books to their children, or converse to their children about the day's events, or to tell stories together, or to do many of the shared activities that contribute to developing literacy and reading skills. I emphasize it's not just how much vocabulary you're throwing at children. It's a social and relational context in which that occurs. As a consequence, the vocabulary gap that we see at age 3 evolves into the school readiness gap that we see in literacy and number skills at school entry, and which in turn evolves into the achievement gap in math and reading that we see at 3rd grade, which is our single best predictor of high school graduation rates. The achievement gap between children in the lowest income families compared to children from more economically prosperous families is apparent at school entry, but only widens over the course of the primary and secondary grades. It all begins early as the first few years of life, and in young children's experiences in a family that experiences the stresses of economic insufficiency. The second point I'd like to make is that growing up in poverty undermines also the development of self-regulation, which is equally important. And it does so because of the effects of stress on young children's biological functioning, the kind of stress that arises when children are living with parents who are themselves overburdened and anxious, in chaotic lives that cannot depend on regular, good quality childcare or transportation, and the threats of poor housing and neighborhood quality. Young children in poverty often have lives of chronic stress, not always, but the chances are increased. And the research in developmental biology is showing that when young children's biological stress systems, which are designed to provide children with short-term coping, is instead activated at chronically high levels, it changes how the system becomes organized. The neurocircuitry itself changes. Children's stress systems instead become hyperreactive to threats to signals of threat or danger, overreacting when these threats are perceived and oriented towards self-protection. Children devote more energy to threat vigilance than to the opportunities to learn from cognitive discovery and exploration. By analogy, it's as if the sports car I drove when I was a young adult, which had overdrive, was driven in overdrive all the time. It would quickly burn out the engine. And that is what we see in young children who are growing up in chronically stressful circumstances. They become overreactive to cues of threat, danger, and the like. When I talk about this with teachers and administrators in California's state preschool system, which serves a high proportion of children from families in poverty, they know exactly what I mean. The teachers can see many of the children in their care overreacting to minor provocations from their peers or falling apart emotionally when they're reprimanded by a teacher, and these are signs of the effects of stress on self-regulation. But there are other signs of these self-regulatory problems as well, such as when these children have difficulty focusing their attention on a lesson or on what the teacher is saying and become easily distracted during circle time or seem incapable of concentrating their minds on the task at hand. In each case, this reflects a ramping up of biological stress system that is vigilant for danger and has much less attention to devote to learning and cognitive growth. And if this continues, these self-regulatory problems can appear in conduct problems, impulsivity, and for some, delinquent and criminal conduct that these children sometimes can experience at later ages. And then finally, as Chairman Lino mentioned earlier, growing up in poverty also undermines children's immediate and long-term health outcomes. We now understand this is in part the result of stresses that are part of children's lives. Stressful events not only ramp up biological coping systems, but they also provoke activation of the immune system, because stresses signal that the protective and self-repair of the body systems may be required. And just like the stress system, the immune system is also designed for short-term activation to respond to immediate emergencies. But when it is chronically activated, it becomes less regulated and poorly organized. The result is that the immune system is also overreactive, characterized by what one research team called pro-inflammatory tendencies in how it responds to everyday events. In this case, heightened activation contributes to its breakdown, and this is one of the reasons that children in poverty are more prone to vascular disease, autoimmune disorders, and premature mortality. The inflammatory systems that are normally designed to help the body respond to short-term emergencies instead become exhausted by the chronic stress that characterizes many children's everyday experiences. In addition, these children face additional health challenges, whether from inadequate nutrition or poor food options, housing and neighborhoods that create health challenges like asthma or other kinds of factors. Thus, an impaired immune system combines with other health challenges to undermine young children's health outcomes. And then the final thing I would point out is that growing up in poverty simply undermines healthy brain development. In part owing to the experiences I've described that are more common to children in poverty, areas of the brain that mobilize vigilance for detection of threat and danger are strengthened. Those that contribute to sophisticated problem solving and self-regulation are undermined, according to brain imaging studies. This is part of what contributes to problems in young children's school readiness and academic achievement, and what contributes to their behavioral problems also in the classroom and in the neighborhoods. As a consequence of chronic early stress exposure, young children's brains become adapted to living in a life of adversity, as well they should. The research is increasingly showing that poverty gets under the skin of children from a surprisingly early age. We're talking literally about some effects beginning in prenatal development to shape these biological and behavioral systems. The fact that these influences begin early is important not only to understanding their developmental importance, but also to appreciating that changing the conditions in which children are growing up at an early age can help to remediate these biological and behavioral effects. The early years are important, and this is one of the reasons why appropriate levels of economic support for children in families below the poverty level is an important part of California's investment in its economic future and in the lives of its youngest children. And I urge the committee to consider also that what these children need are not just access to the resources that children growing up in more advantaged families typically experience, but actually access to resources that are even better than those because of the opportunities to undo some of the effects of stress that these children may be experiencing elsewhere, but also because we get bigger bang for the buck when we invest in higher quality programs serving the most needy children. I'm grateful for the opportunity to comment in these ways, and I certainly would be happy to respond to any questions you have.
Dr. Thompson, thank you very much for the presentation. We're going to hear from the rest of the panel, and then we'll have some questions from the committee. And we'll move to Ms. Stillwell-Parvensky.
Thank you. My name is Michelle Stoll-Parvensky, Senior Policy Associate with Children's Defense Fund, California. The Children's Defense Fund has worked relentlessly for more than 40 years to ensure a level playing field for all children. The CDF grew out of the Civil Rights Movement and Martin Luther King's Poor People's Campaign and has been working to champion policies to lift children out of poverty for the last 40 years. As we heard, child poverty is a moral and economic crisis in our state, with more than 1 in 4 California children living in poverty. And children ages 0 to 5 are the poorest age group. The younger children are, the poorer they are during their years of the most formative brain development. As we heard, growing up poor negatively impacts the entire trajectory of a child's life. Child poverty creates gaps in cognitive skills that we can see as early as 9 months old, and those gaps continue to widen with age. All of those disadvantages of child poverty compound and lead to lifetime consequences. Children who grow up poor are less likely to graduate from high school, less likely to find a well-paying job, more likely to end up in poor health, and more likely to end up in the criminal justice system. Ultimately, child poverty fuels an intergenerational cycle of poverty, as poor children are more likely to end up as poor adults and poor parents. As mentioned, child poverty also has a significant economic cost. In California, the estimated cost of child poverty is $90 billion a year in terms of lost productivity and earnings and increased health and crime costs. Fortunately, though, California has the tools and strategies to dramatically reduce child poverty. A new Children's Defense Fund report, based on analysis from the nonpartisan Urban Institute, found that the nation could reduce child poverty by nearly 60% and lift 6.6 million children, including 2.3 million California children, out of poverty by investing in existing federal programs and policies. At the state level, similarly, California can significantly reduce child poverty by investing in effective state programs and policies. What we need to do at the state level is invest and continue to build upon the existing social safety net. We know that that is working to reduce child poverty. New data released last week from the Annie Casey Foundation found that without government interventions like the Earned Income Tax Credit, child care subsidies, housing subsidies, more than 1.3 million additional children would live in poverty. The child poverty rate would be 40% without this critical social safety net investments. So what we need to do is invest in a combination of strategies to dramatically reduce child poverty. First, California must ensure that parents who are able to work can find jobs that pay a living wage and that's enough to support a family. To do that, the Children's Defense Fund recommends that we raise the minimum wage and enact a state earned income tax credit. In addition, we need to address some of the barriers that prevent parents from working, such as lack of childcare. Second, we need to ensure that children's basic needs are met by strengthening the social safety net, which includes investments in affordable housing, transportation, and basic needs and food assistance for low-income families. We recommend that California increase CalWORK's grant levels, repeal the maximum family grant rule in CalWORKs, and develop more affordable housing. Early childhood education is a key part of a comprehensive anti-poverty strategy for California. As mentioned, the first 5 years are the most rapid period of brain development. And they're also the years when children are most likely to be in poverty and most likely to be in deep poverty. Solutions targeted at this critical developmental period pay off dramatically. One study found that increasing income for low-income families by $3,000 a year between birth and age 5 results in children as adults earning 17% more than similar children who didn't receive that additional income. Investing in childcare and early education for poor children combats poverty in 2 ways. First, providing that immediate assistance to pay for childcare enables parents to work and increases their economic resources immediately. Second, though, high-quality childcare breaks the cycle of poverty the long term by fostering children's brain development and building the skills that enable future academic and economic success. Thus, CDF recommends increased investment in high-quality early education for poor children as a critical component of an anti-poverty strategy in California. And I want to highlight 2 recommendations from our report. 1, expand the number of childcare slots for low-income children so that all families who are eligible for childcare subsidies can receive them. As we will hear later today, many California families lack access to affordable, high-quality childcare. Fewer than 1 in 5 eligible California children between age 0 and 5 benefit from childcare subsidies. Those additional investments in childcare slots will help ensure that young children have the quality early education they need to thrive and that parents have the childcare that they need to work. And second, restore the refundability of the state tax credit for child and dependent care expenses, which helps working families pay for childcare. Under this credit, a family with 2 children can qualify for as much as $1,050 to offset childcare costs. This state credit was originally refundable, which meant that low-income families who didn't have tax liability could benefit from the credit. Unfortunately, 2011 budget cuts eliminated the refundability of this credit, excluding the children and families that need it most from the benefit. As a result of the removed refundability, 220,000 households with annual incomes less than $50,000 lost a total of $86 million in tax benefits to pay for childcare. So California should restore the refundability of that state credit to enable low-income families to benefit and afford childcare. California cannot afford to continue allowing 1 in 4 children to grow up in poverty, harming their health and well-being and undermining their future economic success. The early childhood period offers a tremendous window of opportunity to change the trajectory of a poor child's life. Investing in high-quality childcare and early education, as well as income support targeted at low-income young children, are essential steps of a comprehensive strategy to dramatically reduce child poverty in California and ensure that all California children have the opportunity to fulfill their full potential. Thank you very much.
We thank you very much. I know we'll have some questions for you.
Hello, everybody. Good morning. I'm Kim from the Child Care Law Center, Kim Kruckle. At the Child Care Law Center, we strive to be experts in all of the laws that help low-income families get and keep affordable child care. And I'm going to limit my remarks this morning to how child care subsidies are the linchpin to helping parents achieve employment stability and really earn enough to help their families climb out of poverty. So right now in California, we do have a subsidized child care system that is serving several 100,000 families, and those families by and large are earning less than $2,000 a month. About half of them are earning less than $2,000 a month who are getting subsidies, and about 85% of them are working, and a small percentage of them are working and going to school. That means these are families who are working very hard to improve their opportunities and give themselves a better education so they can earn more money later on. These families who get subsidies also often pay a family fee in addition to the subsidy, but those family fees generally are less than 10% of their income, which is what the U.S. Department of Human Services recommends as the amount families should pay for childcare. So childcare subsidies are helping families earn and slowly but surely climb out of poverty. But unfortunately, we just aren't helping enough of them. And over the last several years, we have had to enact many policies that have reduced the amount of subsidies of families that have been able to get subsidies. So how can we help parents get subsidies and climb out of poverty, get stable jobs? There is a lot of research to show that jobs have changed over the last few years. EDD reports that the highest number of job occupations available right now are in food service prep, personal care aides, retail services. All of these kinds of work are what's known as in non-traditional hours. The shifts are not predictable, and so parents can't really rely on many of the investments that we have been able to make, like state preschool or child care centers that are only open 9 to 5. Many parents these days are working. They never know when they're going to be able to work. So childcare subsidies have to be flexible so that parents can get the kind of care that they need. In fact, there was just a great story on in the news yesterday from Oakland. A family childcare open 24 hours a day, 7 days a week to meet the needs of the families in her community. Actually, it's a husband and wife team. To meet the needs of the family in their community, they said on the radio that they have parents calling them in tears, so thankful for the fact that they are open these hours, so that if they're a cop or working at a restaurant or a Starbucks and they get called at the last minute to go to work, they have a regular place to bring their kids. So I just can't stress enough how much the workforce has changed. And these are families that are earning $19,000 and $20,000 a year. They cannot afford to pay $12,000 for a baby. That's the average cost of infant care, or $7,000 to $10,000 for a toddler. That's the average cost for toddler care. Without childcare subsidies, these families just really can't work. So I think you get the message. I just want to also point out that, there are some specific rules that we had to change over the last few years. Reimbursement rates have stayed stagnant. The welfare to work rules changed drastically. And actually, we eliminated a whole child care program, albeit temporarily, and lost thousands of families. So in the last 5 or 6 years, hundreds of thousands of more families are on the child care waiting list. And these are basically parents whose lives are on hold, who cannot earn, who cannot do better, unless we figure out a way to increase the amount of state-funded subsidized childcare. I'll just close by pointing out that Congress has reauthorized the Child Care and Development Block Grant. This is the primary source of federal funding for childcare for our state, and it gives us an opportunity to really look at how we can streamline and align systems that will help parents work in the coming years. Thank you.
Thank you, Ms. Kruckel.